It doesn't matter if we're talking about a federal agency that runs a $1 trillion budget or a small program in a small town. The one problem government continually makes, it keeps solving the wrong problems. And when it tries to solve the right problem, it's usually too late or insufficient. And this isn't about the people. This isn't about people are bad and blaming them. It's the fundamental way we think and design how government works. Now, the good news is if we created the problem, because all of our organizations are made up, we just have to accept this, we can fix it, all right? So this is where seeing the signal comes in and why it's so important, because it actually exposes the most critical problems we have to solve that are invisible to us. They're buried in layers of bureaucracy and technology and data. You can't see them. And it exposes what matters most to everyone so we can take the right action at the right time to get the results that matter most. And I have run many, many systems and programs and served on the cabinet of many governors, and I've worked with groups trying to transform their systems. And time again, I can see when people apply what we're going to talk about today, they don't just get a 2% incremental improvement, but 25, 40, 600% increase in outcomes for far less money, creating a win for the taxpayer and the customer, which is the ideal win-win scenario we want to get to. And when I talk about this today, signals, you're going to be like, this is so simple. You may not believe, like, why aren't we already doing this? And that's the point. We've lost our way. We need simple, clear, straightforward solutions for the problems that matter most. Simplicity is the answer to government. And that's why seeing the signal is going to be so important. So first, let's talk about what are signals. Let's just level set. We interact with signals all day, every day. Code blue alarms alert healthcare professionals what patients need their care immediately. Trees, beech trees, wait for a strong signal from the sun, 13 hours of continuous light so they know it's safe to bloom and avoid frostbite. We work with signals all the time. They're these amazing messengers, these little communicators that can communicate concise, critical information from one group of people to another large group of people so everyone sees at the same time what they must do and what action to take and when to do it. They're amazing. And in government, when it's just flooded with more data than we've ever had on the history of this planet, technology, endless problems to solve, endless ideas to chase, what do? What do you choose? And that's why signals are so important. They cut through all the confusion. Simplicity organizes the complexity, and they create clarity, the one thing we don't have in government. Simple clarity, not just of what we could do, but what we must do. Now, the reality is if we're not reacting to signals, we're reacting to noise. And noise are distractions, interferences, efforts that don't convert to outcomes. And our organizations are surrounded by noise. Dr. Goldratt, the founder of Theory of Constraints, has had a huge influence in my life. And he once said, there's a difference between a change and an improvement. Change is when we're reacting to noise. We're very busy, but not moving the needle. I call it the illusion of progress. Improvement is when we're responding to signal. We can see and respond to what matters most. Now, in government, when we are reacting to noise, not only are we not solving the problem for the customer, but we are generating the largest source of undetectable waste that exists in government. The cost of wasted effort, cost of delays, cost of poor quality. I can put financial numbers to this. I've run state budgets for years. I've run multi-billion-dollar budgets. You can calculate the cost of this. But they don't show up on our traditional budget tools, fraud, waste, and abuse tools, because those things capture the cost and categorize the cost and track the cost after they've happened. Signals go to the heart of the issue. Right where the behaviors are occurring and decisions are being made, they tackle the causes of costs directly. And here's the good news. When you respond to signals, you get better outcomes for those you serve and you save money. That's the trick in all this. All right, so how do we create signals? There's some techniques and some stuff you got to do, but fundamentally, there's two conditions we have to have. And if people will just start here, they'll start to get some amazing results. So the first one is, who's the center of our signal? Who is the source of the information that matters most, that we're going to pay attention to more than anyone else? Second one, the signals are continuous. All right, let's start with the first condition. Who's the center of our signal? If somebody has a medical emergency, they call emergency services, 911. They become the source of the signal to everyone else that triggers the right response, where they need to go and when they need to get there. Super straightforward. Without the source of the signal being accurate, that system would be in serious trouble. And in government, it's so critical we know who the source of the signal is. We don't create programs in government to make stakeholders happy or to be compliant or to launch a new exciting initiative and get press coverage. The only measure of success is if the primary customer, who this program was built for, gets their most fundamental need met, the purpose of the program. The primary customer's primary need has primacy. It is the filter. It is the North Star for everything we do. It is the source of the signal, always asking those in government, who needs what by when? Now, it seems straightforward, like, of course, why aren't we doing this? Well, signals don't just manifest. You have to create them, and they have to be able to have channels to get to everyone. And they don't live in paperwork or on mission statements on a cute little website or in policies. They live in real time when actions are being taken. You have the siren going down the road in real time is clearing the path. They happen when the work is happening. So absent a strong signal from the customer who needs what by when, penetrating every level of the organization at once, there's a vacuum. And that vacuum will be immediately filled up by who I call proxies, people who are involved, interested, and have oversight. Advocacy group, stakeholders group, our own employees, our technology teams, our vendors. Their pressures, their opinions, their perspectives of the problem dominate the agenda. Not because they're bad, they're actually really good. Most people want to make a difference, so they're going to act on their perception of the problem and with limited information. The IT people think we need to modernize all of our systems. The data people think we need more data, even though we're swimming in it. Management thinks we got to just train our people more. Everyone's working on a fragment of the problem. And this has serious consequences. When I go into organizations, I'll look at their portfolio of projects, IT projects, the contracts they're making, the strategic initiatives, all the stuff. Consistently, now there's some exceptions, but most of the time, 80 to 90% of the effort around projects is spent on compliance, internal priorities like setting up the new data system, secondary needs, the nice to haves, like we redo the website even though it still takes months to issue a business permit, with the customer getting the crumbs. I mean, it's nuts. You don't see that in the budget. It's the biggest source of wasted effort going on out there because the source of the signal is not grounded in the customer. We haven't systematized it. So everyone is clearly aware of this is what we must do now, not this. Now, let's look at how it rolls out in services. So we work in a lot of different systems, but one is behavioral health, hospitals. So this is where people with severe mental illness need to be restored to competency to stand trial or hopefully return to their communities successfully. Usually what happens is the patient has to wait on the system and fit into the system, but we flip the script. We create clinically driven ideal discharge plans. If we could organize everything so the patient got exactly what they needed, when they needed it, right in the right order, what would that look like? I call it the ideal road to the result. This now becomes the source of the signal that tells the system, all these awesome professionals every day, here's the priority, this is what's next, this is what we have to do to progress this patient to a good conclusion. Simple, right? It seems like, what? It's so simple. But here's the result, time and time again. 50% reduction in admission wait time, 22% increase in successful discharges, 15% reduction in budget, more actual treatment hours available, so higher quality treatment interventions for people, reducing the need to expand an entire wing for millions of dollars. When we do what's right for the customer, we save money for the taxpayer. Now, this is not a fishing pole. I've been asked that before. I am blind. And when I was going blind, I was on some of these safety net programs. Grateful that they were there, so grateful to be off of them. I needed simple stuff. How to walk with a cane, how to use technology, how to cook without cutting off my fingers. So, just straightforward things I needed. I didn't care if the government reorganized itself or implemented the latest data dashboard. We get so disconnected. It's this straightforward. Can you say what the thing you're about to do is going to give you a result? We have this fuzzy thinking, long chains of causality, that if our needs are met, we're compliant, somehow we'll trickle down after the billions we spend on technology, and somehow the customer will be better off. If you don't know the result at the start of your initiative, you're not going to know it at the end. The source of the signal matters. All right, now we need to know signals are continuous. We've rooted in the customer. But signals don't just stop at the start. They continue until the end, until the result. And we got to follow that along the way. Signals help us track progress. Are people progressing? And if not, why not? A problem is only a problem within the context of the goal. I'm on the way to the result. Am I getting there or not? Where's quality eroding? Where's rework happening? Where are delays occurring? I cannot know what's in the way until I'm on the way. Signals help us manage progression. Unfortunately, and this is true in every system in government, the principles I'm talking about are everywhere. Government doesn't operate that. Government's all about managing parts. And it's the most flawed assumption we have that, oh, I wish I could just do a Vulcan mind meld on everyone and change how we see the world on this. The idea that we need to optimize every part comes from this. Things feel complex. We don't know how to work in complexity. So we break things into a million parts, a million pieces, measure, control, manage each team, process, function. Thinking that if everything does really well, if everything's fully efficient, if everything is fully optimized, somehow magically the system will work well for the customer. Dr. Akoff, who is a leader in systems thinking, once said, we think our organizations are a product of our parts, or a sum of our parts. Our organizations are actually a product of our interactions. It's not about how each part or person or team works on its own. It's how they work together. And the signals are the interactions. The signals are what communicates across the parts to organize the complexity. They are so beautiful. And if we do not organize around signals that help us organize the parts to the road to the result, we end up optimizing parts that create a maze that we hope the result will somehow find its way through. So let me show you what this looks like. We're doing this my way today, tactically. So this is government, black box. Does it feel like a black box sometimes? It's a black box. I don't even see it, I know it's black. It's a black box. We can't see the signal, so we count how many things come in. We analyze and throw data on it and put more policies and procedures and pile on top of the black box. And then after the damage is done, we do quality reviews and studies and program evaluations. It's insane. Here's the box. How about we lift it? So we lift the box. And these signals today, we can go in and put them in there, but this is not how, because government's optimizing the path. Trying to get each, for example, in child welfare. We're going to mock up a child welfare system. Super hard system. Abuse and neglect of kids. There is no room for error here. Serious consequences. And we optimize for caseload size. This is how we manage this. How many people is each social person working with, each case manager? But we're not managing case progression. So imagine this. Let's say this is two families. All right, pretend you can see this. Here we are. Two families moving through. They're progressing. They've completed substance abuse treatment. They're complying with parental visitation. They're great. But what if you have 4 more families that are progressing and they're blocked? Today, government can't see this. I can, but we got to train government how to do this. It gets blocked. What if this signal isn't there? Imagine if you could see that 40% of your folks are blocked because of a policy, because it's unclear to the front line what to do. This signal goes all the way up, telling IT and policy and management, stop with all the other cute things. This is what we got to fix. Imagine these families are progressing, but in an effort to optimize everything and be efficient, we cut the budget around mental health evaluations. And now these folks can't get mental health evaluations. They're delayed. And we're like, well, what's the problem with delays? Yeah, they wait a little bit. In this country, for every month of delays in the system for these kids, it's not just a toll on them. It's over $1.1 billion a month because we just can't see the signal. This is true in Medicaid, where we spend $800 billion a year. Nearly $12 billion a year just on IT for compliance sake. And the question, are people getting the right services at the right time and the right amount? If not, why not? Can't answer. Despite the tens of thousands of data they collect. Good people, it's not the people, it's the system. People do the best they can within the systems we design. There's a better way. Here's the conclusion. Again, when I was going blind, I thought vision was reality. I thought the lens I used was reality until one day I fell in a manhole and realized it wasn't working for me. The results I wanted weren't occurring. I needed new tools. The vision lens wasn't working anymore. And I learned, game travel, all the stuff. We hold on to tools and the way we see the world so tightly sometimes. But if we want breakthrough results in government, we literally have to break something. And I think we got to break the lens of optimizing every part, seeing things from our perspective, and instead see it with signals. I envision a government in the future that is rooted in trust, clarity, and simplicity over sophistication. That is less worried about how we organize ourselves and govern, but more what are we organized around. That we're less obsessed with data and data-driven decision-making and more about asking better questions. And with all the transactions, are they converting to outcomes? If we want government to perform better, we need to bring different solutions to the table. If we want better solutions, we need to start solving different problems. And if we want to solve different problems, we need to use a different lens, one that's anchored in the customer, that follows the signal, that saves money while getting better outcomes. And that's why we need to see the signal and systematize it. Thank you.